There's a good portion of my client population who are actually not necessarily athletes or doing a lot of what we would consider more hard and strenuous workouts, but they're just day-to-day folks, and they're living with a lot of pain and discomfort. And a lot of these folks have been dealing with this for not only months but years. And so I wanted to touch up on a subject regarding that. Why is that? Why is it that some folks, we start off with some maybe backache or neck ache, and it persists for a couple months and it goes away, and then it tends to want to come back, and maybe we get a little time, take some medications, go to the doctor, get some anti-inflammatories, maybe get some steroidals, and it improves a little bit, and then it kind of rears its head back up. Okay, some of these folks have tried other forms of therapy. They get a little bit better, maybe 20, 30, 40%, and then over time they revert back to where they were. So the question, I actually, when I see these folks, most of the time our first visit is just a conversation, right? I'm basically trying to find out what, where their situation is, where's their life right now, where are they with their work, where are they with their family, where are they with their friends, where are they with a combination of all those elements, right? How's their sleeping, how's their nutrition, are they doing any workouts? Those are very important factors that a lot of times are failed to ask with most folks that they go to, right? And not a failure upon the other healthcare practitioners. It just, folks are really stressed for time. Whether you go to the doctor and your client is stressed for time, everybody's always in a hurry. And what happens is a lot of things fall through the cracks. So when I get to sit down and talk to a lot of these folks, the most important part for me is to listen, right? I got to listen to what you have to say. I got to listen to what's going on in your life, right? Because at the end of the day, all those little factors as far as emotion, right? Physical stress, emotional stress, mental stress, the lack of sleep, probably some poor nutrition involved with there. A lot of times we got family problems, we have problems at work, we have problems with our co-workers. When we're dealing with pain that's been lasting more than 6 months to a year, we would consider that chronic pain, right? And chronic is kind of a ugly word, right? They throw that out there to tell folks, well, there's really not a whole lot we can do for you. I'm going to sit here and I'm going to say, I don't think that's correct, right? There's a lot we can do with folks who are dealing with a lot of these situations, but it all starts with the conversation, right? So to a lot of my physical therapy clients, you've been with me, you've sat down, we've talked, we've discussed, and we have seen a lot of improvement. But the most important part of all that improvement is we have to start with the conversation, right? We do some things with the manual mobilizations, manual therapy, soft tissue work. All those things are great, guys. Those are really good for acute related issues. But when it deals with chronic type pain, that can only get us so far. The rest is a combination of all those other factors. So we have to sit down, we have to talk. We got to find out where you are. We got to find out where you want to go. We got to find out where you are with your work, with your job, with your family, with your friends, with your emotions, with your social outlets, with your nutrition, with your sleep. And we got to get the correct people involved. Are you seeing a doctor?